Michael is a dementia activist, lives with a diagnosis of dementia, and was a core part of the community researchers team. So now I'm going to ask Michael to join me on screen. Welcome to you, Michael, and over to you.
Good morning. Thank you, Alexis, for the introduction. Just very briefly, before we go on to look at the film, just talk a wee bit about, how my involvement and all that, and as Alexis is saying, I was diagnosed with dementia about 3 years ago. And basically, after the initial shock, I thought, I'm not going to beat this. I might as well join this. So I started looking for areas where I can be involved with dementia research. And being an ex-student at Stirling University, so I got onto Stirling and eventually linked up with Louise, which put me onto the community researcher program. And that's really how I got to join the community research group. Things we did, and over the last 2.5 years, we did lots of things. I'm trying to remember everything that we did, and I've got it scribbled down, and the list is endless. Just briefly, we interview 3 beneficiary groups, between ourselves, working with the academic staff. Can also say that the community research team are made up of people from all the 3 beneficiary groups, like living with dementia people, people with unpaid carers, and young people program, so it's a really good mix. Things we did was we interviewed all the beneficiary groups over the first 3 or 4 months. And then we also interviewed the LCT trustees and staff as well. And that was really, really good. And then we were also involved in designing and choosing research methods, which was kind of mentioned during the couple of last interviews. And then further down the line, we started looking at different reports from LCT, where the team were involved in looking at the reports and writing bullet points and all that to discuss the reports. And then towards the end, we were also being trained with qualitative and quantitative research evaluation methods. And then obviously the final thing was the final report that you saw today. I find that over the last 2.5 years, our views were well respected. We were taking this equal partnership with the team. And I think that was really very useful in terms of what we did. Highlight of the 2-year program, I can't really single a single one, but I felt that maybe the interviews with the beneficiary group was really, really, really good, because we heard some moving stories and a couple of things we saw. Anyway, just to summarize and what we've done in the last couple of years, we're going to show you edited version of a film that we did, and maybe you could pick up more from what we did over the last 2.5 years. Thank you.
My name is Alan. I'm a member of the Stirling University Community Researcher Team, which is a team of researchers that are looking into the impact that the Life Changes Trust's funding has had. I am a member of one of the beneficiary groups of the Life Changes Trust, just like all of the co-researchers. I am from the Young People with Care Experience group. The other 2 groups are people with dementia and people who are carers of those with dementia. Today, on the 5th of October 2021, we met to talk about our journey and the project that we've been on for the past couple of years.
I think that was the most enjoyable part for me, was the interviews.
Definitely.
I really enjoyed it. I looked forward to it, and I rehearsed beforehand, getting my questions ready, because we had 5, and it was so easy for the person you were interviewed to move off when you were having to pull them back.
Louise kept us right, didn't she?
To try and get these 5 key points. So it was good to have a framework to work towards, because it kept it structured.
It was good to have those half-hour meeting before the interview as well, with whoever we were doing the interview with. That was key.
That was crucial.
Yeah. Rather than just getting stuck in.
I like the idea that with the 5 questions, we didn't just say, right,
Louise to do all the 5 questions, we do an alternative question. And that was really good as well, because it means that we felt really involved with the whole interview session as well, you know, and I think that was a really good thing about our role, you know.
I guess as well, I mean, I wasn't involved in any of the interviews, but I think it was you that had said it can only benefit the interview to have somebody with lived experience as part of the interview team, as it were. I don't think that can be sort of replicated any other way without you guys.
I did want to say especially that they're having the diversity of the group. I think we did kind of mention that, but that's a key part that I think if this were to happen again, that would be a great part of doing it, not having just co-researchers that are isolated in silos, but having, you know, young people with care experience and people with dementia and carers of people with dementia. I think that's really been, it's so hard to put into words, but I think that's really benefited us in tangible ways as well. I just don't have the words to describe exactly how that's happened, but it's been an important part for me anyway. It's been good.
I was looking back at the notes that Louise written about our meetings and all that, and a lot of the information and the ideas didn't just come from the academic staff, they were shared amongst us, and you guys have taken on board what we've suggested. Some of them were obviously not great, and you just rejected it, which is fair enough, you know. But at the same time, we listen to each other, and we are sharing the experience from each other and bouncing off each other with ideas. And I think that's the great thing about the team, you know.
And the other thing that was good was that you involved us in the analysis,
That's right.
which was quite challenging because of the
Tell me about it.
some of us probably did it better than others, but the analysis was quite different and it was quite challenging. But then I think we identified that we needed more training. And then once we got the training, it kind of all fell into...
Yeah.
It was quite good having a bit before the training.
How closely did it match between your expectations of what co-researchers would be like in working with them to how it actually panned out?
Well, I didn't have a lot of experience of co-research, so I'd done lots of those kind of projects where you go and interview people with dementia or you interview family carers. So I don't think I had a huge expectation. I was very aware that people talk about it a lot, and then when you read the journal article or you read, I can't find it. I'm like, what do they mean by? So I really didn't want. That's why I suspect a few of you felt like you've been thrown in the deep end of a swimming pool, because I was like, you're going out to do the interviews, we're doing this properly, you're just going to come. I don't really care that you signed up last week, you can come and interview this trustee with me this week on Zoom, we'll be fine.
I mean, in a way, you listed a few bullet points about the co-researchers, but throughout the last 20 months, the team has moved the goalposts all the way for the better, I think, you know, and I think that's really what co-research is all about, isn't it? You listen, everybody listens to each other's information, bounce off ideas, and I think that's what's the good thing that came out of it over the last 20 months. You know, our team here, we're all equals, you know, and I think that's a good way to move forward with a lot of projects and organizations. We shouldn't just have that person there. I know the reason why that person's there, because if anything goes wrong, it's your fault. You know, I think that's part of the problem, being a leader, you know, so watch out, Alan.
Just back to the benefits of having community researchers, which I think is what this part is going to be about.
Right. That's it, very
I
fast.
think for future researchers, you have to have that mix, because we're kind of the bridge between theory and real life. Because you can read as much as you like about anything theory-wise, but till you've lived it, and I mean, I can't imagine what you guys, a wee bit imagine, but till you've actually been there and done it yourself, it's a whole different perspective, you know. So you need the two sides, don't you?
I think that also with the evaluation, the project, I think is kind of triggered off a lot of new initiative in other areas, because I was speaking to Rosie recently, and NHS Scotland has set up a new thing called Neuro, no, you keep me right, I'll send you the link for that. And basically they're looking for partners in research, which is their definition of community researchers, you know. So that means that what you guys have started here has triggered out a lot of new initiative right through the area. So they're looking at people from the academic side and the people who are living with that particular area, like in dementia. I'll get you the proper link later on, you know. They're looking for people.
And I think the project itself has created a legacy.
Yeah.
Because that PhD students and people who come to me now are more looking for us to be involved earlier on, rather than just be the guinea pig. They want us to look at how they are looking at us on the committees to frame the questions or whatever. And so I think kind of the project itself is creating a legacy, which is good.
To me, you know, I think it opened up a lot of doors for myself, you know, in terms of my past profession's gone now because I've retired for 10 years, and this has opened up a new revenue or a new ideas for myself and how I can move forward, you know, not necessarily just dementia, just in everything, you know. I just see life totally different for myself in terms of my development, you know.